It is time for another Y107 MU Healthcare Ask the Expert podcast. And with May being Stroke Awareness Month, no better guest to have on than MU Healthcare neurologist Brandi French to talk about why MU Healthcare is the place to go for certified comprehensive stroke care. We start with a very simple question. Why is it important to talk about stroke?
Well, there are several reasons it's important, particularly to our home state of Missouri. Stroke is the fourth leading cause of death in this state. And when you look nationwide, including in Missouri, it's the leading cause of long-term disability for patients after they've had some form of illness. Other reasons that it's important is that early recognition is absolutely crucial for us to be able to deliver the best stroke care. The earlier we have someone in the phase of their stroke, the better our treatments work and the better the long-term outcome is. If we wait longer and longer, the phrase is time is brain, and those nerve cells are dying every minute. I think the fourth reason is to know that much of stroke can be preventable, or at least there's a lot we can do to modify whether or not we have a high risk for stroke. So controlling just a few things as far as our health is concerned can really go a long way in reducing our risk.
How can you tell if you or a loved one or someone is having a stroke?
Well, there are a couple of different things that you can look for, and the acronym is Be Fast. So that reminds us that it's very important to be fast about recognizing whether someone might be having a stroke. So the B stands for balance. Is someone able to keep their position? Are they able to stand upright? E stands for eyes. Are people having double vision or abnormal eye movements? Are they looking off in different directions? F is for face. Have someone smile and give you a good look at their teeth. Is one side of their face drooping or not? A stands for arms. Have someone raise both of their arms in front of you. See if one of them is falling faster the other one. S stands for speech. Have them say something. Sing the ABCs or happy birthday. It's hard to come up with things to say when you're under pressure. But do those words even make sense? Are they the right words? Are they slurred words? And T stands for time. Again, be fast.
And we've got Brandi French on with us this morning. She is a neurologist with MU Healthcare. And MU Health is the place to go for certified comprehensive stroke care for you or a loved one or really anybody. Why is it so important, Brandi, for you to get help very quickly if you or someone is suffering from a stroke?
So immediate treatment is really key. We only have a few hours to deliver some of our most effective therapies. So patients come in, we need to know exactly when is the last time you were normal for you, because based on that timing, we can offer clot-breaking medications, or sometimes we can go in with catheters to try to retrieve a blood clot from inside the brain. Now, that's not to say if you feel like you've waited too long, we can't help. We have a lot of things that we can do, even if you feel like, maybe things started yesterday, there's not anything they can do for me now, and that's simply not true. So some of the big bang for your buck stuff is right up there at the front, but please come in at any time you feel like you may have suffered from a stroke.
What is a symptom that someone might overlook if you're having a stroke?
I think the thing I hear most from people is somebody was just confused, or they didn't look right, or they were saying things that didn't make any sense, and they kept on putting in the wrong words, or things just sounded, people say, like gobbledygook. One of the other things is people couldn't figure out how to do stuff that they know how to do. Tried to brush their teeth with the hairbrush, or tried to use the remote control like a spoon, or couldn't figure out how to stir when they were trying to cook, or to use the knife when they were chopping things. Just those are some of the things that are harder to tease out, and that's why we're always here for you in the emergency room to come in without any delays. So that's our job. That's what we do, is we try to figure this out for you.
And as always, better safe than sorry. Call 911.
Call 911. You don't have to call your doctor's office first. They're going to send you to the emergency room anyway. And when you call 911, the wonderful thing they do is they activate the stroke team in the emergency department. So by the time you arrive by ambulance, your team is already there waiting.
So what makes MU Healthcare the only mid-Missouri hospital to earn the comprehensive stroke certification?
Every year, usually around February, we go through a very rigorous 2-day certification process, and an external team of reviewers comes and looks at every facet of care. They visit our emergency room, they look at our ICU, they look at our laboratories, and they make sure that we're adhering to our protocols. They read all of those protocols and really take us to task. They look at patient charts and make sure in a de-identified way, make sure that we are following all the rules, that we're meeting all of the standards that provide the highest level of care.
So in wrapping things up here, Brandi, what sets MU Healthcare's stroke care apart from the rest?
The comprehensive stroke certification really ensures that you are receiving the most up-to-date, highest quality care that is available on the market. Not only does it do that, but it allows you the opportunity to participate in research trials so that you get the best quality of care or the best prevention for maybe another stroke that we're hoping won't happen. On top of that, our endovascular and vascular physicians are board certified with subspecialty experience in caring specifically for stroke patients. And 2 of them are literally household names in the stroke world, in the stroke community among clinician scientists. And we're very lucky to have them with us, offering some of the most cutting edge therapies that you can imagine. Our team is available 24/7. You will always have access to a trained stroke neurologist, and you will always in the the intensive care unit have access to physicians who have done subspecialty training in learning how to care for patients who are very ill and to do so from a neurological perspective and expertise.
When minutes really matter for you or a loved one, there's only one comprehensive stroke center in the region. Learn more right now. Log on muhealth.org/minutesmatter.